Hi, my name's AGoodall from Cass Business School. Thanks for inviting me to talk today. You may have noticed that experts have become rather unpopular in the world. People only tend to listen to experts when they have to, and that time is definitely here. Parents are certainly only interested in the best experts when little Johnny is sick. I'm hoping today that I can leave you with the impression that we need our best experts to lead and manage our organisations. Do leaders matter? I really believe leaders and managers greatly influence the performance and create large spillover effects on employees, and that feeling has really come out of my research. There's thousands of books and articles on leadership, yet still generalisable evidence is lacking. So the question that kicked off my research was, how much core business knowledge should our leaders have? Does it matter to the performance of Mercedes-Benz that the head of the company, trained as an engineer, has a PhD and worked in the company most of his career? How important is it that the director of nursing is a celebrated nurse who has had a successful clinical career? Does it matter if that nurse left nursing very early in their career and went into management? Does it matter if the CEO of a hospital is a doctor as opposed to a non-medically trained manager? And in these cases, it helps if you also have a blue suit. And why are the most successful consulting firms led by their best and longest serving consultants? And I think this is important. The big four, the big consulting firms, are extremely successful organisations. Engelbert, who is a former CEO of Deloitte, she joined the firm in 1986. Her successor, Rengen, joined in 1985. In the Boston Consulting Group, Rich Lesser joined in 1988. Doughty, chairman and CEO of KPMG US, began her career in 1985. DeCibio joined in 1985. And Moritz joined PwC in 1985 also, and you get the picture. These consulting firms have people who start in them when they're knee-high to a grasshopper, and they stay in that firm for almost the whole of their career. The reason I think this is important is because these firms give a lot of advice to healthcare organisations. In 1 year alone, the NHS spent $422 million on management consultancies, but the global figure is huge. So I guess I sometimes wonder, are the major consulting firms preaching what they themselves practice? I'm not sure that they do. We advocate in our research for the use of greater internal consulting for problem solving in health organisations and less of a reliance on management consultancy firms. So, what's our key idea in this research? The main message I want to leave you with is that successful leaders are those who have a deep understanding of the core business of their organisation. That being a capable general manager alone is not a sufficient condition. Okay, I'm going to give you a quick run through the evidence. I'm afraid it's going to go quite quickly and we're going to be touching on lots of subjects, but I know most of my audience, and I speak a lot to doctors, as I'm sure many of you are, they like data, and I think it's really important to present the evidence. It all began when I was working with leaders in research universities. I worked with Tony Giddens at LSE and another leader at Warwick University. And my research question when I came to do my PhD was, who should lead research universities? Should they essentially be good managers or good scholars? My key findings in my PhD was that the best universities are more likely to be led by top scholars, and top scholars seem to improve the later performance of their university. This is just one simple diagram I'm going to show you. You can see that out of the top 100 universities in the world, the top bar, the very top of the top bar is Harvard. This is the top 100 universities broken down into quintiles. And on the y-axis is the president's lifetime citations normalized for their discipline. And as you can see, there's a clear monotonic decline. The higher the university in the global ranking, the more likely it was that their president was also highly cited. So what evidence was there that scholar leaders actually improve performance? In other words, that it's not just a one point in time correlation, that Harvard becomes really good and then you plonk a great researcher on top. So this was an important part of the research. In the second part of my study, I looked at the performance of a university 10 years after a leader was hired, and then I used multiple regression equations to control for a number of different variables. I found, again, that the higher a president's lifetime citations, the more likely it was that their research improved, that their university improved its research performance. And that was published in this book in 2009. So the next step was to go inside universities and look at heads of academic departments. In work done with 2 economists in the United States, we asked whether economics departments improve after they appoint a top scholar as chairperson. We looked at the change in performance of 58 US economics departments over 15 years. After adding controls for chairs' characteristics and other institutional factors, we found that departments go on to improve when they are led by chairs, department chairs, whose own research is well cited. In which other setting have we identified the expert leader finding? Basketball. In this work with Larry Kahn and Andrew Oswald, we looked at longitudinal data which had information from 15,000 basketball games. We controlled for a number of factors again, and we controlled for team payroll, the position, and other factors. And again, we found that star basketball players make better basketball coaches. And basketball teams in the NBA won more games if they were led by coaches who were star players or had long playing careers. And this is a very simple diagram. You can see the pink bar is the one where the coaches that had a long playing career, and the blue bar are those who didn't play basketball. So we looked at Formula One racing, and this is work with Ganapog Rebner. We looked at the performance of every team in 6 decades of Formula One championships between 1950 and 2011. Again, after adjusting for a number of factors, we find that the most successful team leaders in F1 motor racing are more likely to have started their careers as drivers. 10 years driving experience was equal to 16% higher probability that the leader's team gained a podium position. And you can see this is a picture of Lewis Hamilton. Lewis Hamilton is about 6 years old at this time. And if you imagine that he started racing around a track extremely fast at 6 years old, you can imagine the core business knowledge that he has acquired throughout this whole time of his career in racing driving. Let's move on to medicine, which I'm sure most of you in the room are very interested in. In my study, I asked a very simple question. Are hospitals ranked higher when they're led by doctors or professional managers? And essentially what I was doing was I'd found this pattern in a number of different data sets, and I was looking for more data to test this out. And that's what I did in 2011 when I published this paper in Social Science and Medicine. I had US hospital ranking, data from America's Best Hospitals in 2009, US News and World Report rankings. And I looked at the CEOs in the top 100 hospitals in 3 specialisms: cancer, digestive disorders, and heart surgery. I separated very simply the CEOs into physicians, doctors, and non-clinical professional managers. And we had as a proxy the size of hospital also. But this was a very simple one point in time correlation. And I should say that I always start with a simple correlation, and then I go on to look at longitudinal evidence. If you can't find it in a simple correlation, it's probably likely that there isn't a pattern there. It doesn't necessarily mean you've got causality, but that's the starting point. So my results, we found there was a positive cross-sectional association between hospital performance and physician leadership. And this remains significant after controlling for the potential confounders. As you can see, this is the diagram, this is cancer and the 2 other specialties. And you can see the pink bar are the hospitals that were led by physicians. Now, as I said, I did this just as a simple study to try and replicate this expert leader finding. But when this paper came out, I must say I was quite shocked at the response. It went quite global through the media, through health websites. it got a lot of traction. And I realised later the reason it got a lot of notice was because people have been talking about physician leadership and there have been lots of articles about it, but no one had actually tested in the most simple way whether doctors actually could or were leading outstanding organisations. So I guess even though this was a simple one point in time correlation, it was the first kind of research and that has now been replicated, thankfully. Hospital quality scores were approximately 25% higher in physician-run hospitals. A recent study has come out and built substantially on this early paper, and it's done by Kazi, Keswani, Bozak, etc. And they examined whether hospital systems led by physicians are associated with better quality ratings, but also with financial performance and operating efficiency, compared with those led by non-physician managers. Tazi and his colleagues found that hospital systems that were physician-led had higher quality ratings, but this time they looked across all 12 medical specialties, whereas I only looked across 3. They also had more inpatient days per hospital bed than did non-physician-led hospitals. And there was no difference in the total revenue or profit margins between the two groups. And that's quite interesting because one of the things that I've been told throughout the time I've been working on this research is that, well, doctors might be good at some of this stuff, but when it comes to money, they're no good. Well, it turns out that there is no difference in this study between doctors or accountants or whoever else happens to be running hospitals. So that's quite significant. In a new paper that we're looking at data from Iran, we've looked at, again, hospitals in different types of hospital systems. We looked at hospitals in the public sector, in the private, and NGO sector in Tehran. And we again divided the senior executives in the hospital into 2 groups, those who were clinicians and those who were non-clinical managers. And you can see again in this diagram, we have found exactly the same pattern. The green bar includes all of those who are doctors and also some nurses. The majority are doctors, but there was about 6 or 7 nurses also. We're finding the same pattern again. Is this expert leader finding only relevant in settings with doctors, scientists, and other professionals? No. In work with 2 colleagues, Arts and Oswald, we looked at a random sample of 35,000 UK and US employees who were matched with their firms. And we found that the single strongest predictor of job satisfaction is boss competence or expert leadership. The research identified 3 critical influences on job satisfaction. When employees were managed by a supervisor who could perform the employee's job, if the line manager worked his or her way up the company or started it, and a supervisor's level of technical competence as judged by his or her employees. And all 3 of these are predictive of substantially greater levels of happiness among employees. This bar diagram is really important. And in fact, when I first saw this, I have to say I was astounded by the effect of expert leadership. The long bar, well, on the y-axis is job satisfaction. And you can see the first bar is expert leadership. As you can see there, pay is in the middle, and the competence of your boss is worth double your pay to your job satisfaction. And I think that's an incredible finding, actually. So we now know that employee job satisfaction explains a lot of our expert leader finding. Healthcare workers, we know that their well-being is linked to patient outcomes. Job satisfaction and worker well-being are important to individual and organisational productivity. And I've just put up a number of articles here in case people are interested in looking this up. The evidence is growing more and more. And in a way, it seems obvious that happy workers are likely to be more productive. I wonder why it took us so long to discover that. In research with one of my main co-authors, Agnes Baker from University of Zurich, we looked further into the effects of bosses or line managers in different settings. Line managers, I probably think, are the most important people in organisations, because most of us, all employees, have a line manager that they report to. And this person, as we've seen in the previous slide, has a very big impact on how we do our work and how we feel. Although the boss has a massive impact on the whole organisation, individually our line managers affect us most. So that's why we wanted to focus on this, especially after the previous study which I've talked about with arts. So we surveyed 600 faculty reporting on their department chair, the head of department, in UK and Swedish research universities. And in medicine, we looked at 350 doctors in 3 Zurich University hospitals, 270 doctors in South Australia, 285 doctors in training, so junior doctors from Wessex Deanery in the UK, and 3,500 doctors in Denmark. All of these doctors are reporting on their immediate manager, who is also a doctor. And this is work that's again done mainly with Agnes Baker, but also with Michael Beck and Jason Geertz. 5 countries, 5 data sets, 1 story. In these 5 studies, if respondents reported that they had an immediate manager, a line manager, who is an expert leader, so that is academics reporting that their department chair is a highly rated researcher, or doctors reporting that their immediate manager is a highly rated clinician, these academics and doctors were also much more likely to report high levels of job satisfaction and low intentions to quit their job. This diagram is one from Danish data, and as you can see in the first column, job satisfaction, the average job satisfaction is on the y-axis, and as you can see from the first column, if the supervisor is reported to be a highly distinguished clinician, job satisfaction is higher, and you can see there is a clear monotonic decline again. The competence of your boss will determine your job satisfaction. Amazing. So how do expert leaders influence the job satisfaction and quit intentions of employees? And this is where we're trying to work more on our theory. Our evidence suggests it happens through the people practices of the line manager and the work environment that expert leaders create. From our study of academics in research universities, having a department chair who was rated by faculty as a distinguished or highly distinguished researcher also correlates very highly with various job characteristics and management practices. And from our hospital surveys, we find the same. So when managers are viewed as outstanding clinicians, doctors also report that managers give them better feedback, that they are more consultative, that they understand the nature of the work, are rated as a good leader, and morale is rated as excellent. And in fact, in the Zurich study, we also asked doctors about trust and bullying. And we found again, if you had an outstanding clinician as a manager, you also had greater trust in the hospital's management, and you felt safer from bullying, which was fascinating. Now, these findings don't mean that every single doctor or basketball player or lawyer is going to be a good leader. But on average, this pattern is found and is reliably statistically significant after controlling for many factors and across many different data sets now. Naturally, being a doctor or scientist, lawyer or engineer is not a proxy for having management experience or leadership skills. Leadership and management training is critical, and it is now widely recognised as being important. And in fact, we have created an Executive Masters in Medical Leadership, one of the few in the UK that is targeted and designed exclusively for doctors. An article in the BMJ recently asked, why are so few NHS CEOs doctors? We thought this was interesting. So we asked what would motivate doctors into leadership and management roles. In a new study, Danish doctors were surveyed through the Organisation of Danish Medical Societies. We asked what would motivate them in a survey to go into leadership and management. And interestingly enough, I was asked to do this. I was asked to give a talk in Denmark because the government were about to make changes at that point in time, and Danish doctors were getting I guess, some pressure to go into leadership and management. So people are coming and saying to me, come please and talk to our doctors and explain to them why they need to go into leadership and management, in other words, because it really contributes to organisational performance. And they really thought that Danish doctors weren't interested in going into leadership or management. Turns out, when we did the survey, and we surveyed all doctors, we had a response rate of 19%, 3,500. 70% said that they would consider taking a leadership or management role. So we thought that we should ask doctors what their incentives might be to take on these kind of positions. And in the survey we said, what are the job characteristics and incentives that might lead you to say yes to taking on a leadership or management position? There was 12 choices, and you can see from the bar diagram that the overwhelming majority of Danish doctors said they'd take on a position if they can have a positive impact in healthcare, which was extremely interesting. The second one, which I think reveals a lot, it tells us a lot about how doctors are aware that they need leadership training, was to receive leadership development training. And third, an increase in salary. Salary is interesting also because many people think that doctors are intrinsically motivated, and they are, to do medicine. They are very strongly intrinsically motivated to do medicine. But if you want to take doctors away from the kind of role that they do in medicine to do something like leadership and management, naturally you have to pay them more. You have to pay us to do things that we don't want to do. That's normal, and that shows up quite strongly here. And of course also out of a sense of duty. And you can see there are a number of characteristics. I'm not going to go into them all. We also asked them, what would incentivize you, or what would the disincentives be? When would you say no to taking on a leadership or management role? Again, won't surprise anyone in the room, if it takes away from their clinical work, if they have more administration or meetings and have to work longer hours with more stress. They also felt that there was, if there was a lack of resources, fear of burnout, which is a major problem in healthcare naturally. And interestingly, if they felt the organisation was not open to change. Finally, we thought it was very important to ask these doctors under what conditions they might do leadership training programs, because obviously everyone recognises if you go into leadership, you still need to have some training. And they overwhelmingly said if it contributes to their personal development, and that was over 70% of respondents tick that. Again, they mentioned salary, time in lieu, and other factors, as you can see. Now, the reason we did this was to gain some understanding about the conditions under which doctors would go into leadership and management positions. So instead of people assuming that doctors didn't want to take them, we're trying to change the lens so that we get organisations to think differently. So our conclusions from that study that we've just submitted to a journal are that health systems should adapt to reflect the motivations of their clinicians, not expect their employees always to adjust to suit the organisation. And that's particularly pertinent in systems like the NHS that are constantly going through change all the time. Second, we thought that it was essential that they offer high quality leadership training, ideally training that has been tailored to their needs. And again, this is important because if we're going to have doctors go into leadership and management, they need to be successful in it. So we need to help them out. And finally, this is especially important at a time of high reported stress, burnout, and recruitment and retention challenges. So what we're trying to do is say, if you really want to stop people from leaving, if you really want doctors to go into leadership and management, and I think we've tried to show you today that the research is there, that you're going to have happier workers if you do have experts in leadership and management positions, then the organisations need to recognise that, and they need to change their incentives to suit their employees. Okay, thank you very much. I'm going to leave it there. My work, by the way, is all available on my website.